everybody. I'm Dr. Caitlin Brigler, and today I have the pleasure of speaking with Dr. Gary Wilkerson, a certified athletic trainer, fellow of the National Athletic Trainers Association, and a tenured professor at the University of Tennessee, Chattanooga, in the Department of Health and Human Performance as part of the Graduate Athletic Training Program. His recent research has focused on injury risk prediction in athletes, and Dr. Wilkerson will be speaking at the upcoming SNS Symposium, giving a talk titled Reduction of Sport Injury Through Application of Performance Neuroscience Principles. Dr. Wilkerson, thanks for being willing to speak with me today about your talk.
Glad to be with you.
As I mentioned in the introduction, your recent research has focused on risk prediction for injury in athletes. Can you tell me a little bit about how this might apply to sports concussion, how this might be interesting to neuropsychologists?
I think I need to go back a ways to kind of explain how I got to this point. As an athletic trainer, I spent many years in clinical practice where the primary thing that I was dealing with were ACL tears in the knee and chronic ankle instability. So I developed a primary interest and expertise in understanding what's causing chronic dysfunction in lower extremity joints. And then over time, once I got into an academic setting where I've been for the last 25, going on 26 years, my research focus began to get more and more narrow on trying to understand why we were seeing more lower extremity injuries after concussions. I had not developed a lot of concussion expertise up to that point, but it was clearly apparent to me that the lower extremity dysfunction is not a purely mechanical problem of ligament laxity or muscle weakness. Clearly, the brain's controlling everything. And so I began to look for ways to quantify um, the relationship between cognition and motor control.
Yeah. Yeah. And as neuropsychologists, we certainly, appreciate that interplay and that relationship. And so the more that you got into that, the more you kind of started applying these models and this thinking that you'd been doing in these lower extremity injuries to other kind of injuries in athletes.
Right. Yeah. Um, I've spent a great deal of time reviewing the available literature that's out there to help guide the process of figuring out where is the system breaking down, where do our problems exist. Um, I, Most of the research that's relevant is coming from very sophisticated diagnostic testing, functional MRI, EEG, CT scans, which are not in any way practical for being able to assess and monitor the status of an individual. So I've spent a lot of time looking at just about every system there is out there to try to understand a little bit better uh, reaction time, response accuracy, and have been assessing the limitations and the advantages of different kinds of instruments and trying to get clinical evidence that's inexpensive and feasible to do in a clinical setting to try to determine when an individual's status is suboptimal.
Yeah. And, obviously, there's a great deal that neuropsychologists can learn from your expertise as an athletic trainer and from your expertise kind of doing this deep dive in your research. So what do you think some of the takeaways or some of the things that you're hoping that the neuropsychologists can get, out of your talk at SNS and kind of your learn from your expertise?
Everything that I do, I try to ensure is grounded in evidence and solid theory. What I will try to convey is what I think is very, very good alignment of the prevailing models of how decisions are being made and how those are integrated with motor actions. I think the evidence is pretty clearly pointing toward perceptual decision making as a very, very critical factor in leaving an individual susceptible to a given situation. And that decision making appears to be very, very strongly related to brain state transitions, different networks switching on, others switching off to not create interference, and producing the best signal to noise ratio in terms of assessing how efficiently the brain is performing. So what I'll talk about are some metrics that I've been using to take the speed accuracy trade-off, but then also look at variability across trials, which is proving to be a very, very good indicator of these brain state transitions. I think the neuropsychologist who's dealing with psychological issues such as depression and anxiety and sleep deprivation, I think you might see some common themes that run through the effects of multiple concussions, for example, in how the efficiency of the processing that we can measure behaviorally, I think pretty precisely, can help us to identify people early in what could be a very long and chronic process of further degrading function and quality of life into the future.
Yeah, yeah, certainly just from hearing the small bits that you've shared today, I know that there's going to be a lot of interest from the neuropsychologist. There was a ton of questions I myself thought of, and so I look forward to, this little teaser of your talk has me excited to hear more in May. So, I want to thank you for speaking with me today. I personally, and I know the rest of the sports neuropsychologists will look forward to learning more about sports injury through this lens of neuroscience principles at SNS in Cleveland this May. And those listening can learn more about the conference and register to attend on the SNS website, sportsneuropsychologysociety.com. You can also follow SNS on Facebook and Twitter. And we're looking forward to seeing everybody, including you, Dr. Wilkerson, at the 14th Annual Concussion and Brain Health Symposium this May 14th to 16th in Cleveland, Ohio.